Welcome to the Health Tech Edge. I'm Mike Moore. Today, I'm joined by Jack Stockert. Jack is Managing Director at Health 24/7, a physician by training, a former McKinsey consultant, and an entrepreneur who's built and operated healthcare ventures, including a Medicare Advantage plan. Jack's work sits right at the intersection of clinical reality, payer and provider operations, and system level innovation. In this conversation, we're going to stay practical. We'll talk about where AI is actually helping right now, why many pilots fail, what Medicare Advantage can teach us about payer side AI, and what all of this means for the future of the medical profession. Jack, welcome to the podcast.
Thanks, Mike. Great to be with you.
All right, great to have you. We'll go ahead and dive in. So you are a doctor. You wanted to be a doctor your whole life, and went through the process of the education and the training and certification and all of that. But then you stepped away from practice. What changed for you about medicine and the practice?
Yeah, I have four children at home, so I'm trying to figure out what age it was that I wanted to first be a doctor. I think it was probably around 7 or 8, given that my 4-year-old wants to be a leopard. Um, I I got into medicine, and to be honest, my first patient on my third year rotations in internal medicine rotations, where you're basically getting to experience what it's like to be an internal medicine doctor or a surgeon or a psychiatrist or an emergency room physician. And the first patient on the wards was 28, on the south side of Chicago and dying of complications of end stage AIDS, HIV. And I'm not old enough for that to have been the reality that he should have been living. There were drugs available, there were therapeutics, and to actually help manage that condition and that disease, he should have had a much longer life. And I began to ask the question of where are we failing Marcus? Like where did we go wrong that we can't have fixed this problem? And that overwhelmed me, that question, to the point where everything I loved about medicine and what I thought was beautiful about the idea of serving others, which I still have as a motivating factor of my DNA, was complicated in that kind of rush of what the reality of the medical system was at that moment. And I think I began searching for what the right path was, and how to think about best influencing and tackling the challenges so that we could avoid that issue and that we could also just deliver a better healthcare experience and system for all of us. So that led me on the journey, which took me to many of the places you mentioned. I even spent some time overseas at the WHO as well. So it's been a global journey that now has led me to Health 2047.
Yeah, that's great. Well, I think, it is there are some bright days and some heavy days as you practice medicine, right? I just know from my own, I'm not a medical professional myself, but I'm married to one. So my wife is a registered nurse, and she's practiced in many clinical settings. And that, just knowing some of the stories that she tells and supporting her as much as I can on the bad days, it's a lot to bear. And I think that sometimes we forget about that healthcare, ultimately, obviously, is a human business, but we think so much about the patients and what they and their families go through. But the burnout of clinicians and the impact and the emotional toll that it takes is worth considering. So as you've expanded your career, you've stayed in healthcare and also worked in other industries as well. And really, your experience as a consultant with McKinsey as well, kind of having that system view of how everything is connected, and there's a lot of variables, right, to manipulate in various things. What do you think you learned from the non-healthcare industries and that are beneficial lessons for healthcare, especially as we're at this inflection point with AI adoption, kind of on the precipice of really doing great things, we think.
Yes, consulting, as you know, Mike, is a profession that has a variety of different viewpoints from the outside in. But when you're in the work itself is trying to tackle and answer really difficult problems. When I first started into the consulting space, I had my MD already, and there was obvious push and desire to have me pursue healthcare projects. But my desire was really, at least for the first 12 to 18 months, to push against that and explore everything from airline operations to economic development work in Western New York to a variety of other types of software technology strategy work. And what I gathered from that are that the inherent business problems that exist for given companies, whether that's an airline company trying to figure out how to manage failure loops on large, expensive parts and repair loops, which is a just difficult operations problem, isn't far afield from some of the operational challenges that exist within a hospital system. And so what you begin to find out is there are a lot of brilliant people tackling these problems in different contexts, in many different spaces. And so it was eye-opening for me to meet and interact with those folks. My MBA that I pursued at University of Chicago also was a way of doing that. I remember my first day in business school, a friend called me doctor, and I'm like, I'm not a doctor yet. And he said, you're the closest thing we get to talk to. A third year medical student is good enough that we're going to call you doctor. So much to my resistance, I think the reality of that you realize is that there's just a lot of brilliant people across the wide berth of industries in America and globally, and that healthcare is often prone to ask the question in a way that frames it as unique to healthcare. And while there's certainly truth to that, there's complications in healthcare. The uniqueness of what the end product of healthcare is unlike anything else. As you spoke to with regards to your wife and her experience in her life, there's nothing more human than the product of healthcare, but some of the challenges are inherently universal. And so having brilliant minds think about those is kind of an early lesson in my career development, and that's carried me through into the investment and innovation space.
Yeah, and I think there's a lot of those lessons. Like there's some things that are really unique about healthcare operations, both on the payer and provider side. And obviously there's the clinical side of it and care delivery and those kind of things. But I know a lot of your focus and thinking is kind of about what can be done on the workflow and the administrative side. Do you want to talk a little bit about your perspective and where you see some opportunity really in the near term for AI and its ability to influence workflow and administrative work?
Sure. If we take a step back and think about the application of AI in healthcare, it's useful to frame it as you just did. Let's think about it in terms of application within the administrative side of healthcare. And that's a big part of healthcare. Healthcare transaction costs range between 15 to 20% of every dollar spent is just on the transaction of the dollar. Some work out of Stanford that suggests, your general office visit costs $120 to $200 to transact. That seems absurd in some respects, unless you understand how claims and processing and authorization and coverage and in-network and out-of-network and all these terms and things that most people really don't want to care about, nor should they have to care about when they're consuming healthcare. They just want to, what are their goals around health? How do they achieve those goals? How does the clinician deliver the best or the care provider deliver the best and most effective care in that moment? So that administrative chunk is one piece. And then there's the application of the technology into the clinical space. So if we walk down the path you just took us into the administrative side, it actually is, I think, most helpful to think of where AI is best applied in that space. And so AI is really good at non-context specific repetitive tasks where there's a lot of core initial existing data to train models on, at least the current models of AI technology, and that there's a ability to measure the output of that. And so that works really well in a lot of things on the administrative side. And so those workflows, which don't touch patients, but inherently involve patients because they're part of the transaction space of healthcare, are really exciting places to apply. And even if we decrease or cut in half the cost of the transaction of a healthcare dollar to 7 to 8%, that's some pretty significant savings that ultimately filter through in a variety of different ways because of the complexity of healthcare payments, ultimately to consumers and individuals' pockets through lower premiums over time, maybe more benefits through their health employer if they're paying health insurance or what have you. So I think that's the most exciting space because it fits the use cases of the technology. If you think about where we see all the venture investment right now in the non-healthcare space, it's useful per your earlier question, which is encoding applications. So non-contest specific, lots of data, easily measurable. Does the code work? Or we see it in customer service and phone and retail kind of phone management types of applications where you can scale these tools to handle a lot of inbound customer service calls and the like, and lots of data, repetitive tasks, non-context specific, the stuff that becomes context specific, you obviously shoot off to a human. And so we see that in the non-healthcare space. And so I would anticipate finding those types of use cases. And what's fun about healthcare is that 15 to 20% represents quite a few unique to healthcare, but consistently similar types of problems as those kind of non-healthcare specific investment areas. And so we're seeing innovations in those fronts, and that's exciting. The clinical path, which we can go down or not if you would like, is more complicated and interesting to me, but it's something that we can pursue if you'd like.
Yeah, I think the administrative side, I think it's smart to point out that while there are some, as said in kind of my question, there are some things that are unique about healthcare, but everybody who has a call center in whatever industry would benefit from having AI handle the more routine things and not the phone tree that we're all used to, right? The interactive voice response is even kind of a bit of a struggle,
Which one do
right?
I push?
Which one do I push? And if I say the right word or not? And conversational AI agents have been transformative in that area. The adoption needs to scale, obviously, too. When you look at the clinical, or I'm sure, we'll talk more about your work at Health 24/7 and kind of what you guys are doing there. But when you're talking to healthcare leaders or they're looking for those ideas about where to start, clinical, operational, administrative, those kind of ideas, you've mentioned a couple of areas too, but what do you think are some of the ones that are those areas that are really ready for it today? This episode we're recording at the end of 2025. It'll air probably in the beginning of 2026. If you were setting out the plan for 2026 and you were kind of back on the seat, of either the health system or the payer side, what would you take on as some areas to focus?
In the clinical space or in the
Either,
specific
yeah,
place?
your choice.
So I'll parse your question in two ways. I'll talk the clinical space first, because I think what I would do in 2026 for physicians is advance their involvement and their interest to be involved, depending on what side of the table you are, in the imagination of what the possible is. And I think the headline of AI is coming to replace me is a threat for a lot of different people across not just healthcare. But I think the idea of engaging with tools to advance medicine and health in general has been something that physicians have done extraordinarily well over a long period of time, all the way back to whether it's the invention of the stethoscope and the ability then to better understand heart sounds and then better treat cardiovascular disease, all the way through the invention of the MRI and imaging modalities, and how do we use those and come up with different ways to better inform our ability to help make the right health and therapeutic decisions in times of emergency, the right triage in an urgent moment, and then on a management moment, how do we help best effectively manage the health of patients? So imagine the possible of what 20 years from now looks like, and then come back to today and engage in the conversations around where to best implement the early stages of those to try and experiment and learn. We're still horribly bad at measuring outcomes in healthcare. We are not great at listening and understanding where patients or individuals, as most people define themselves over the majority of their life, not the 2% of the time they're in the healthcare system, and what that experience is like and how to best implement that into how we think about healthcare decisions and health decisions. And so I think there's a lot of opportunity, and I don't know where that goes because I'm not either smart enough on the technology front, and I am not practicing as a clinician. So my hope would be to bridge that dialogue and have physicians understand that it's not about a threat to them. It's about imagining what that future state looks like, and then evolve the profession to adapt to that. Maybe it's new training groups, and maybe it's a new fellowship that you learn this technology and help lead and implement it differently. But if we aren't thinking about where this could potentially lead us, as we've done with all other technologies, and we instead approach it from a defensive and threatening position, then it will progress in its own way, and in a way that's, I think, less consistent than what I would want as a patient, and certainly what I would want as a physician. So that on the clinical front is about defining new workflows, not living within the existing ones. Where do these tools best fit? How do we think about implementing those and accept the realities of what the system is today and where it could go? On the other front, where I think the health payer and health provider side of things and applications of these technologies is two threads. One is a little bit of what we talked about. How do we lower the cost of transaction and simplify the performance on a payer side? So in Medicare Advantage, you're seeing the applications in the call tree and customer service space. You're seeing it in a positive way, at least. There's a negative, two sides to every coin. But on the positive side, on the ability to track and manage all the things that you have to do to improve the quality of the care you're delivering for your members. So tracking everything from the screening things that you're supposed to do to other stars measures and metrics around medical adherence and the like. And so these tools are really helpful in making sure we hit the marks on those things. There's a cynical view, which is you can utilize these technologies to kind of try to game the system and, upcode and risk and do a wide variety of different games on that. But I think over time, the majority of health insurers, especially the ones that I've been associated with closely, are trying to deliver the best care at the most efficient and effective and cost effective level for their members, and to deliver services that help those members live healthier lives over longer periods of time. Because if you don't do that, then you aren't in the business very long. And so you can make a quick early buck by doing the games on the risk coding stuff. But if you aren't maintaining those memberships over time and using the technology to engage with those members, have them feel included and engaged in their health and in what their goals are, then I think you'll lose out. And so the companies that I think are leading best on that front are developing their own brand and connectivity with members in a way that we haven't seen before in health insurance. And then I guess the second part of the bucket on the administrative side is and the non-clinical side is the provider operations bucket. And that group is interesting because they have a little bit of providers have always been, 10 different businesses under one roof, and their application of the technology, whether it's processing a larger amount of data from the patient room to engage with a patient who's developing bed sores and needs to be turned sooner, or perhaps it's helping automate and simplify a professional like your wife, the nursing staff, where there's systems that are able to track everything that's being done and they help pre-draft the notes and lift the administrative burden of documentation off, or maybe it's the application into the compliance and certification space. And those are all really interesting and compelling spaces for the technology to be deployed because it's essentially making the job of healthcare a more enjoyable and better performing job without taxing the clinicians or the care providers in the same way that like EHRs became really taxing in the past.
Yeah, I think that's a common theme that we hear, and the phrase that a lot of people use is helping clinicians operate at the top of their license, right? There's that,
Yeah, it's a good way to think
wide
about it.
spectrum of things that we talk about that a clinician, whether it's a doctor, a nurse practitioner, physician assistant, right? They take many forms in this and many titles, but giving them time back to spend more time on patient care and the things that are operating at the top of their license that really benefit, from their experience and their training versus administrative work that could be done by a lot of, either by automation or by others. And I think even for the non-licensed professionals in an organization on provider or payer, it's helping them operate on higher value tasks as well. So there's
Yeah, but I
there's
have a
administrative
question for you.
workflow.
I have
Yeah,
a question for you on this front. What do you think the ratio of administrative staff to let's do it this way. Physicians to administrative staff was in 1970,
in
roughly.
1970 it was probably,
Physician to administrative staff.
yeah, physician to administrative, it was probably one to, I won't even say 1 to 1. It was probably less than that.
It was around 6 to 6.5 to 1. 6.5 physicians to 1 administrative staff. Do you
And
know?
now it's 1 to 2, I believe. Is that right?
No, no, no. Well, it depends on where you're looking in measures, but I think the U.S. Labor and Bureau of Statistics has this chart. I'll send it to you after, but it's 10 to 1 administrative staff to physicians.
Wow. Yeah.
Now that's grown since 1970 to today. And so you're asking what happened in healthcare that led to that? But those are the space. So when we talk about AI in healthcare, what you just spoke about is the beautiful way to view it, right? Which is we have these brilliant nurses who are compassionate and emotionally engaged in helping these patients in one of the most difficult moments of their life get through it. You have clinicians who are passionately and humbly engaged to try to help make the best healthcare decision in that moment. That's the stuff we should get out of the way of, right? And empower. So then there's like, well, where'd those numbers come from? What are the 10 administrators doing to the one? Now, some of those are nursing, but nursing hasn't grown massively, and that's not the problem. More nursing is probably better, and we have a shortage of nursing. It's all the other aspects around the administration of it. So all the things, what happened since 1970, Medicare, Medicaid, all the different aspects and layers of administration, prior authorization, HR and the technology department growth, like those are all the pieces that have added administrative heft. Now, some of those might be necessary, like perhaps we're in a better system because we can have digital health records, which we didn't have before. That's probably a better place than everything on paper and in a folder in a filing cabinet. But the question is where are we going and how do we maybe we're at the peak of that and that number can come down as we see technology deployed.
Yeah, which is a tremendous opportunity. And I know that, in particular, you have experience with Medicare Advantage, and I believe you've said that you think that's a really opportune or a really kind of hot opportunity zone for AI right now. Do you want to talk a little bit about your experience with MA and why you think AI can make a difference? I mean, the population size that's on Medicare Advantage. I know John Oliver did a episode a couple of weeks ago here in 2025 where he was kind of pointing out some of the things that are kind of strange about these programs and the naming convention and kind of the benefits and all of this. There's a lot of heavy marketing that goes into consumers for this program. But what's your take on kind of the state of Medicare Advantage, where the opportunities might be?
Sure. I mean, I think since 2007, when it was 19% of all Medicare beneficiaries were on Medicare Advantage, to today, which is 54%, to 2030 to 2034, depending on what you're looking, where you're anticipating 64 to almost 2/3 of all Medicare beneficiaries being on a Medicare Advantage plan. I think you have to ask so there's a variety of questions that raises, which is, why the growth? What's the point? Where are we going? What are the implications of it? you know, 50% of those are still provided by your traditional incumbent payers. And that was because the ability to put new membership onto existing infrastructure was pretty much a straight to bottom line accretive dollar add, right? I think that world of Medicare Advantage was like the early pickings, a bunch of dual covered entities and members, and where the reimbursement was high, and there was a lot of just fat around the system that you were able to extract. The next wave, the innovation wave, and there's been hit or miss on some of these. There's been the pure tech plays, which didn't play out exactly as we wanted to, like with Clover, where it was a bunch of, I remember meeting some of those brilliant individuals who they had nothing to do with health insurance and were like, we're going to reinvent all of health insurance. They're like, well, you might want a couple health insurance folks on staff to help you understand why it is the way it is, because it's not all bad. It doesn't all need to be blown up. And they've since come out of the darkness and are really doing some innovative things. And Zing, which is the Medicare Advantage plan that we launched, you've got Devoted, which is backed by some Sand Hill Road investors, are really trying to ask the question of if we take the construct of Medicare Advantage, but we try to deliver a more member specific business where the products and services we design meet the needs of the specific populations that we're able to micro target and bring in as members. So rather than just bring everybody in, for Zing, it's chronic special needs. We're going to be really good at taking care of for the minority and underserved populations in urban centers where we see a lot of congestive heart failure and cardiovascular disease, diabetes, and stage renal disease. We're going to develop specific plans and products that serve those populations really well. And we're going to develop networks that meet those needs. Now, it's not perfect and it has the challenges of any health insurance business, but the excitement about those types of businesses and the idea of Medicare Advantage being a growing and continually growing space is that it allows for a lot more novel innovation in healthcare delivery. Traditional Medicare fee-for-service it's a pretty standard product and delivery mechanism. The government does try to do a variety of different innovative initiatives, but none of those are really at scale across all those members. So now what members are getting are more choice and more options. That comes with John Oliver's points, which are well taken about the perils of a pure money grab. But I think if you look at this over the course of a decade, you're going to continually see probably the rates on Medicare Advantage come down. It costs more than the traditional fee-for-service Medicare patients right now for taxpayers. But I would think that you're going to see that come down. And the government's ability to measure outcomes and quality by mandating it as a part of the economic incentive structure, I think really drives innovation at these firms. And that's what we've seen in the businesses that we've been a part of or that we've been adjacent to.
Yeah. Yeah. I think just going back to your point about the, kind of outsiders coming in and wanting to, blow up the industry and, those kind of concepts. I remember when Oscar launched, actually, one of the co-founders is a former colleague from Microsoft. And, it's exciting when people come in with a fresh set of eyes and look at things. I mean, you can still see this happening right now where, the dollar, what is it? The Mark Cuban's pharmacy program there, the
Yeah.
Base Plus I'm butchering the name of the business, but you see him learning on Twitter, now known as X, I guess, in real time, kind of like someone had a thread about credentialing and how difficult that is to get physicians credentialed. And he was asking them like, well, tell me more about this, right? Because he's never heard of this issue and that it's such a problem and now wants to learn more. Just like when he first learned about pharmacy benefit managers and the role that they play. There is good when kind of the Silicon Valley, set mix in with the healthcare industry, and there is the opportunity for some disruption and innovation. Then there's kind of the technical debt or the administrative debt that comes in and gives you a bit of a reality check of like, okay, you can't just stop what we're doing, blow it all up, rebuild it in the most ideal form. If transformation were that easy, boy, would the world be different, right? And AI, certainly AI may be the closest thing we have to that, to the ability to blow things up and kind of reinvent, but there's still the transition and kind of the pain that's associated with that I think we're all going to struggle with for many years to come.
Yeah, I think meeting it with open arms and an openness to the possibility and the possible, I think is an important thing to do. And I think it's brilliant that you have thoughtful people, whether it's Mark Cuban or others, willing to engage in a dialogue around it. And if they're seeking to understand as much as we're seeking to try to find a path forward. So why is credentialing? There's a lot of legacy, both political as well as regulatory rationale that's well thought through by really thoughtful and creative people around why something is the way it is, why there are state to state barriers and licensure and practice. Like, why is it the way that it is? And you can get angry at it and be like, well, this is silly. This doesn't allow my telemedicine company to scale. But I think understanding the inherent rationale behind why it was structured the way it is and having people being willing to listen and understand, but then on the flip side, being willing to acknowledge that evolution is good, but we don't need a revolution because the revolution may disrupt more than what we maybe intend.
Yeah. Well, let's use this as a way to transition into your current work. Obviously, you've got a lot of great experiences, but I think it'd be great to hear what Health 24/7 is and what you and the team are working on, especially as it relates to certainly the future, but also the here and now.
Yeah, so Health 2047 is the innovation enterprise founded by the American Medical Association. And its expressed intent initially was to, I remember being asked, don't be a venture fund. It's not that venture funds are bad. It's that what they wanted to do was help influence the direction of the work against the right problems. And venture is a balance of problem, solution, and market. And I describe them as brilliant surfers. They're out on their surfboards ready to surf whatever the wave is that's going ashore next. Their job is to return capital to their LPs, a worthwhile goal, and in the process, build transformative businesses that hopefully do that. I think the observation was, where's that gotten us in healthcare? And this is so circa 2015. And at the time, there were a bunch of app-based businesses and the like coming out. And I think the rationale was, we're missing the mark on the quintessential element, which is where we started this conversation, is the doctor and the patient. And how do we, the care provider and the individual, if we broaden it, and how do we think about what empowers that? What are the breakthroughs that transform that? EHRs did not transform that directly, right? So they, in fact, intersected and separated that. You now saw your doctor and their computer was between you and them in their first iterations. The nurse had the wheelie R2D2 and was in there. And instead of them just having a passionate human conversation, which is what healthcare is, a relationship, it is a humbleness, it is a vulnerable interaction, and it was making that colder and more separate. And so the question became, how do we actually build the innovations that are taking advantage of some of the technological capabilities, but with that innovation at its center? Presents itself unique challenges where the venture model doesn't always work. There's reasons why there haven't been waves to surf that solved the particular problems of particular populations or physician problems. There's not enough docs, for instance, so the P times Q math doesn't work, or whatever it might be. And so Health 2047 was really meant about finding businesses that tried to tackle those problems uniquely. So whether that was partnering early on, so the AMA was one of the first organizations to identify obesity as a disease back in 2010 and 11. And ultimately, we partnered with a company co-founded out of Mayo Clinic with some leading researchers. This is 2019, 2020, so before the GLP-1 movement, because they were breaking down obesity, the monolithic disease of 120 million people, and saying doctors treat phenotypes. It's not that everybody has the same disease. And so it's breaking it down. And by breaking it down, you help people understand that it's not a moral failing. It's not a personal problem of willpower. It's actually a disease process. And then how do you design innovations? How do you identify the right responders for surgical intervention to actually tackle this? So it's a very physician oriented way to think about the market. And then we had scaled that business, and that's moved into and caught the wave of the GLP-1s. But it was very early in the recognition that what we were doing in obesity wasn't working and we needed a rethink. Zang, which we've already talked about as a business that's taking the Medicare Advantage insurance concept, but deploying it to populations that were under indexed. So we gave those big numbers earlier in the conversation, but those weren't urban, minority, African American, Latino populations. Those weren't the people being targeted by the traditional insurers going after MA. We said, what's it look like if you actually design products that understand the challenges of where those people live and what their inherent, if you live in a food desert, advising someone to eat a particular diet, it's a different proposition than advising someone who lives where you or I might live, Mike. And so what's it look like if you design a product specifically for them? So understanding the root problem and then trying to build a business around it is the challenge. So you're starting at the problem and building out. And that's been the work that we've done. We partner with existing companies. We've launched companies. We have a collaboration with the digital education business that's trying to scale an educational platform, both internationally in Rwanda for nursing staff there, as well as across medical schools in the US. But then we have some AI businesses, foundational model in radiology, which is trying to take technology of today and transform the medicine of tomorrow. And so it's a wide collection, but it's a unique set. There's a variety of physician founders that we're partnered with, but that's not our criteria of our work. We just want to work on the right problems with brilliant and thoughtful innovators and find pathways to sustainable businesses to grow them. And so sometimes that's venture, sometimes that might be alternative financing, other times it's growth equity, other times it's just simply supporting the business that's already profitable and finding growth avenues to scale and have a broader impact.
Yeah, that's amazing. And I think that, going back to where we started, it's that call to service that you felt, as a child and wanting to help people, and the way that life it takes funny twists and turns, right? In the way that it leads us. And I think what's the Yiddish proverb, "Man plans, God laughs," right? So here we are,
I
where
like that.
you know you've been called to serve and to help. You're just doing it in a different way than you initially thought you're going to do. But the beautiful thing is it's still connected to the world of healthcare, which you have obviously great passion for, the way you talk about it, and what you see as the opportunity. So before we close, we're going to air this in the start of 2026. If you're a healthcare leader listening and thinking about AI initiatives, what are some quick hits, Jack, or some kind of parting words of advice to think about as you're planning with the team?
If we just encapsulate the things that we talked about in this call, identifying those tasks and roles that fit really well with the technology today, begin experiments sooner rather than later, where you can learn in a quick time frame. My experiences with these technologies is that within 3 to 6 months, you can garner a lot of information and knowledge about whether or not it's truly impactful for your work, and engage early with your employees and have them be champions of it and not scared of it is an important thing to do, because I think that allows everyone to act from a position of strength and confidence, and that'll allow you to find the best avenues and opportunities within your business to deliver either more effective care, more cost effective performance, or better growth.
Yeah, that's amazing. Yeah, and I think letting employees or encouraging employees to be part of it, they're already using and experimenting with AI tools either for their work or in their personal lives today. That's what the data at least shows, that especially clinicians are out there experimenting. So why not open it up, make it a collaborative process? To your point earlier in the conversation, it shouldn't be a position of fear or defensive position. It should be about looking for those opportunities where we can all operate at a higher level, better serve those that whoever that population might be, patients, members, or others, to just find those opportunities. So we've covered a lot in a short amount of time. I think big takeaway is obviously AI has a real opportunity to make some impacts and workflows, whether that's Medicare Advantage or providers, operations, or payer operations. So really getting out and putting things to the test, I think, and seeing, I think whatever we've seen in 2025 is probably going to happen even faster and bigger in 2026. So lots of exciting things. So Jack, thanks for being a part of the conversation today.
Yeah, Mike, I really appreciate you having me. It's been a lot of fun. Thank you.
All right. Well, thanks for listening to Health Tech Edge. If you found this helpful, share it with someone who'd get value from it. And if you want more conversations on how tech is reshaping healthcare operations, follow the show and stay connected with us. We will see you next time.